I would like to thank the scientific committee for the opportunity to present our study at this EBMT, which evaluates the impact of donor type on allogeneic transplant outcomes in severe aplastic anemia using post-transplant cyclophosphamide. As we know, HLA matched sibling donors remain the gold standard for younger patients undergoing allo. However, many patients lack a suitable matched sibling donor, and while matched unrelated donors are a common alternative, finding an appropriate match can be challenging, leading to the exploration of mismatched unrelated donors and haploidentical family donors. And despite the increasing use of PTCy to prevent GvHD, its impact on severe aplastic anemia patients has been scarcely evaluated in the study. So this is why we wanted to investigate this issue. So our study, conducted on behalf of the Severe Aplastic Anemia Working Party of the EBMT, analyzed 348 patients who underwent their first allo transplant from 2010 to 2022 with a matched sibling donor, unrelated donor, or haploidentical donors, all receiving PTCy for GvHD prophylaxis. And the conclusion of this study, and recognizing certain inherent limitations, as is the case with other registry-based analysis, our study highlights the efficacy of PTCy in achieving low rates of acute and chronic GvHD in patients with severe aplastic anemia undergoing haploidentical matched sibling donor and unrelated donor stem cell transplantation, with no significant differences between donor types. However, the higher non-relapse mortality and poorer survival outcomes in haploidentical transplants underscore the challenges associated with increased HLA disparity. Among donor types, matched sibling donor transplant resulted in the most favorable outcomes, including the lowest non-relapse mortality and best survival, reinforcing their status as the preferred donor type when available. In the absence of a matched sibling donor, alternative transplantation from an unrelated donor also demonstrated better outcomes compared to haploidentical, and finally, conducting prospective controlled studies is crucial for advancing our understanding and improving outcomes for patients with severe aplastic anemia undergoing allogeneic transplant.